Hey everyone, this is Mr. Garberich from About Face Anti-Aging Institute, and I'm super excited today. We're going to do some cool stuff. We're joined here with Nancy. Nancy came in with some complaints of some lines around her mouth and in her lips. Even though she's never smoked, as we age and we lose volume, we all are going to get some of these lines. So today we're going to use Volbella. It's from Juvederm, Allergan, the makers of, they make Juvederm. And Volbella is a super soft, super smooth filler that I can use very close to the surface of the skin. And so it's actually made, first FDA approved device, or filler for the perioral or around there, smoker's lines or lines around the mouth. So I'm going to go ahead and get started. I've already cleaned her lips. And so now we're going to use a topical numbing cream. So I'm going to put that on. Nancy, you can just relax back into the chair like you are and just keep your lips closed for me. So we're just going to put this all over her. So this is a combination topical numbing cream. It has benzocaine, lidocaine, and tetracaine. Those are just the reason why there's three. One comes on faster, so we get good rapid effect, and then the others last a little bit longer, so we get the duration that we need for the actual treatment. So once I'm done applying this topical cream, we're gonna let it sit here for about 25 to 30 minutes so it can get some good absorption, and then we'll get started. Okay, I'm about to get started, and I've actually decided after further assessment we're going to do a little bit of two different fillers. So Volbella, I talked about, is amazing for the little lines around the mouth and even the little bit of the lines in the mouth, but it doesn't add a lot of volume and it's not as stiff. So I'm going to also use Juvederm Ultra, which is great for the lips, but it's more volumizing. And so I'm going to start with this one to get some stabilization of the lines around the mouth and a little bit of volume in the mouth. And then I'm going to come in behind it actually and layer, and I'm going to do a little bit of Volbella around the mouth and a little bit on top of in the lips as well. So get this here. It comes in a sterile package, so I'll put that label on our chart when we're done. It comes with its own needle, so good there. All right, so Nancy, are you ready? Okay, so I also talked about Nancy with Nancy, this little device, and this is vibration. So the body can interpret pain or vibration, one or the other first, and it likes vibration. So by holding this against her skin, it's going to help decrease the pain because it's going to distract the brain from what I'm doing. Okay, so she's going to hold it on her left side, and you're just going to tilt your chin up for me. Okay, let me do a little bit more. Perfect. All right, so I'm actually going to start up here. So you can see across the top of her lip, she has a bunch of lines around her mouth. But she also, the top of her mouth is flat, or lip rather. And so she's missing these little columns. They're called filter columns, and it should look like an upside down A. So as we age, they get flat and disappear in some people. So there's a little hint of them, but they should come right down to these 2 points. If you can see here, one and one there, that's the top of the Cupid's bow. So I'm gonna put us a little bit in there to start. And so I'm just gonna pinch up where that Cupid's bow is. Maybe a little pinch here. Perfect. I'm going to slowly inject while I'm pulling back on the needle. I just want to put a little bit in there. Also trying to keep an eye on where I'm at, so I put the same amount on each side. Perfect. Now she has a mole right here on the right side of this little column, so it makes it look a little bit bigger, but awesome. So you can see already just by doing that the right side here is, turn the lip up a little bit. And I haven't even put in anything in her lip. Again, she has this little mole right here, so just molding it here, making it a little better. Okay, now I'm gonna have her turn her head for me. I'm gonna do it from this side so you guys can still see what I'm doing. Put your chin up for me, dear, and move the vibration to the other side. Great. So, getting that angle, a little pinch. And then again, slowly putting in as I pull back. Okay, now you can see how this little column is raised here a little bit, right there. And her Cupid's bow is now up. So that's the start. Get that up first. Open your mouth a little bit. Open more, like say, I'm just getting, she has a little bit of numbing cream in there. I just don't want her to get it on her tongue or anything. Okay, close. How was that? Okay, doing okay? All right, wonderful. Okay. All right, now you can move to the other side. So now what I'm going to do is I'm going to go around the outside of the lip a little bit, right here on the top. This is called a big pinch. The vermilion border. You can see my needle raise. You can see it in the. It's a little like tunnel. I'm just threading my needle up there, and I'm going to do just a little tiny bit. There. Perfect. You can't put a needle in the lip or pretty much anywhere in the body without a little bit of bleeding or something. So we're starting to stabilize the lip lines, and you can see just by doing a little bit around the outside. I'm gonna have to come back and touch this up, but you can see that it's turning the lip up. And Nancy and I talked before. She doesn't want a lot of volume. She doesn't need a lot of volume, but it's more the lines that are bothering her. So we'll just give it a little more in here. You can see that, beautiful. See how that turns that lip right up? And I'm trying to make sure that this is smooth across there. So you can see already from the right side to the left the difference. It looks awesome already, and I haven't even done anything in the top of the lip for the lip lines yet. So once I get the lips stabilized and around the border to where I'm happy, then I will come up here and do some in the lines themselves. So, okay, so I've done some work on the top lip. You can see already the improvement here. Nice pink showing, getting some of that edge, vermilion border, that little white roll. You can actually start to see her lips, which is awesome. So, and it's not too much, it's subtle, and that's what we go for. We don't want anyone to know that she had anything done, so it's looking very good. She's tolerating it very well. And so I've actually changed needles, so it will be more comfortable for her. And so relax your mouth. So now we're gonna do a little bit in the bottom of the lip. So again, I'm gonna do a little bit in this little border. Right under the lip here. So you can already see the difference in light reflection. So right here, the light is reflecting down now and it's hitting that, and that's why you're seeing that, because it was flat like that with no light reflection, and now you can see with a little bit of volume that she's starting to get that light reflection, which is nice. Now these lines right here, these little ones, I'm gonna do probably with the Volbella, but we're gonna give, like we did on the top, a little base to stabilize them. So I'm just gonna keep coming around here. Again, you can see my needle tunneling through that vermilion border. Close. You can already see it's subtle, but from her right side to her left, where we're putting in some of this border, it's filling in a little bit. So that's good. Top looks really good. We're doing great. You're doing great. Okay, so I've done almost a whole syringe of the Juvederm Ultra in and around her lips. Now I'm switched to the Volbella, and you can see this comes out. This is super soft, super easy. You can see that. Just tiny little droplets. And so that's what's so great about this filler is I can put it really close to the surface of the skin. And we'll come back and we'll touch up some of these other areas that I need to. But so you can see top lip looks amazing. Bottom lip looks really good. We just need a little touch up some of these lines down here. But I'm gonna start doing working on the lines up above the lip. The trick here is not to add a lot of volume. Okay, so the plunger force that I've used is very, very light. So I'm gonna do some in and around these lines. I mean, it's just a, I don't know if you can even see it. I mean, you can see that improvement, that little line on top. Maybe you see this one here. So I'm just barely under the skin and I just tiny, and that pops up. It's not gonna make it go, it's not gonna be perfectly smooth like, you know, when we're 20, but you can already see that one line is already improved. So I do a little bit in each line, just a little bit, and then I'll come back and I'll massage it. So you can already see that filling in up there. Looking great. She's handling it very well. This is a very sensitive area, and even so, the topical lighting medicine that we use, as well as you see that little indentation just go away, and the vibration I think is also helping a lot. So these little areas are just, it's a little tedious for us, you know, we have to keep going around these little tiny lines, but you can see that one just pop right out. Awesome. So she's doing very well. Not adding it I'm trying not to add any volume. Now, of course, there's a little bit, but the trick is to not add any volume. I'm just trying to get right underneath that line. It's right in the surface of the skin. So we'll do just a little bit. Already improving, and then when I'm done, I'm going to massage it down, and it's going to be even smoother. But you can already see the difference from the right to the left. All right, so we've done some work on the right side of her face. You can see the difference between the right and the left improving already. I haven't done massage yet, so this will smooth out even more. I started a little bit on the bottom, and again, like we talked about, the line's pretty deep, so what we're trying to do is improve them. A little stingy up here, sorry dear. So again, I'm just going right under the line. So there's different techniques you can do. Some people will go straight up into the line. Some people will do a little just dots into the line. So we use a combination of all of those depending on the line. You can see this is that mole that I was talking about right here. But it's kind of like a ditch that you want to support almost, if you can think about it that way, where you want to come across the line this way underneath to give it some perpendicular support, if that makes sense. So, trying to pop these little lines out. She needs some good stabilization underneath the line. So I'm just gonna come all the way up here and just a little bit. And again, once I massage these down, they'll start to get better and better. Pretty deep. Nancy, how's your experience so far? How are you doing on pain?
Wonderful.
Okay.
The pain is not bad at all.
Wonderful. Is the vibration helping you?
Yes.
Great. So I'm just gonna continue around here. Now this filler is one that's not very hydrophilic, meaning it doesn't like to attract a lot of water to it. So that's why we can use it very close to the skin. Now that being said, it will attract a little bit of water. So these lines will fill in a little bit even more over time. She had this natural little area right here that's kind of pushing out a little bit. So I'm gonna work on that as I come around. But other than that, things are looking really well. Okay, so as you can see, we're continuing to work around the lip. The bottom lip is looking really good. So for me to get a little bit more help, what I've done is I've injected a little bit in this line right here. This is called the nasolabial fold. So you can see the difference between her left and her right by just adding a little bit in that line. What that does is, she didn't actually mention the line, but by doing that, it turns the lip up a little bit like this. And so every little bit that we can do helps. So I'm gonna go ahead and do the other side. So we'll just come right up in this line. So you could probably use a little bit up here too, but we're gonna just do a little bit in here, right under the skin. And in this area, I'm gonna aspirate, which means I'm gonna pull back on the syringe a little bit, see that there's no, make sure I'm not in any vessel or anything. Make sure there's no blood in there. So just slowly pushing some in and pulling back. I'm just gonna redirect my needle a little bit. And you can see it filling in and filling in a little bit of the top of the lip. Just like that. And then we massage it down a little bit. And you can see the difference in that side. Turn towards me. Awesome. So her right side is a little deeper than her left. Everybody's faces are, the sides are asymmetric. We like to say that the sides are sisters, they're not twins. So we're gonna I'll probably do a little bit more in here. This side came out really nice. I have a little bit left. And then I'm gonna do some massage around the lips, and then we'll be done. So I'm gonna do a little bit more up in here. So we're all finished, and so this is gonna be the first time that Nancy has seen what we've done for her. I've seen the before and afters. They look amazing, huge improvement, but we're gonna let Nancy take a look.
Wow. No, that is unbelievable.
Great improvement, right?
Mr. G, this whole experience just blows me away. I thought I would have some, noticeable results, but I feel like this is, it has taken years off my life. So,
oh, well, wonderful. Well, I'm so glad that you enjoyed your experience.
Oh, it wasn't bad at all. I thought it would be painful. Could I really do this? And yeah, I was pleasantly surprised. You have made this an experience that was totally tolerable, and I would recommend it for sure. But you have been absolutely amazing.
Thank
and
you.
I think it's you've given me like total confidence in what you do.
Oh, well, thank you. Well, I couldn't ask for anything more than that. That was awesome. She's amazing. She did very well. And so we just invite you guys to come on down if you have similar concerns to About Face Anti-Aging Institute. My name's Mr. G. If you call the number below, we can get you in for a free consultation and we can get you some wonderful results.